This video is for education only, not personal medical advice. The Wolverine Stack involves investigational peptides, and these compounds are not approved by major regulators for the uses often promoted online. G'day, I'm Professor Gordon Slater, orthopaedic surgeon in Sydney. Today we're looking at the so-called Wolverine Stack, what it is, why it gets attention, and what the evidence actually shows. The Wolverine Stack is an informal term for combining two synthetic peptides, BPC-157 and TB-500. It's commonly promoted online as a recovery aid for muscle, tendon, ligament, and post-surgical healing. The name comes from Wolverine, the Marvel character famous for rapid healing. It's memorable, sure, but it also creates a lot of hype, so it's worth separating the nickname from the science. BPC-157 is linked to research around tissue repair, inflammation, and blood vessel growth. The key point, though, most of that evidence comes from preclinical studies, mainly animal models, not large human trials. TB-500 is related to thymosin beta-4 and is often discussed in the context of cell movement, tissue remodeling, and wound healing. That's why it's often marketed for soft tissue recovery. Put together, these peptides are said to have a synergistic effect. In plain English, the claim is that the combination may support recovery more effectively than using either one on its own. Now here's where caution matters. There are no officially approved or standardized human dosing protocols for the Wolverine Stack, so anything you see online should be viewed very carefully. You'll often see protocols mentioning daily BPC-157 and weekly TB-500 over several weeks, but these are not established medical guidelines. They're usually anecdotal, experimental, or based on weak evidence. So what does the research say? In animal studies, the findings are certainly interesting. Some reports suggest improved tendon healing, wound repair, and reduced inflammation, which explains the ongoing interest. But in humans, the evidence is still limited. We simply do not have large, high-quality, randomized trials showing that this stack is clearly safe, effective, and superior to established treatments. And that distinction really matters. Something can sound biologically promising, but that doesn't automatically translate into reliable clinical benefit for real patients in everyday practice. There are also unanswered safety questions, including long-term effects, contamination risk, product quality, and broader concerns about how these compounds may interact with healing pathways in the body. From an Australian compliance perspective, the TGA has not approved BPC-157 or TB-500 for therapeutic human use, so these substances sit outside routine, mainstream, approved treatment pathways. In the United States, the FDA has also not approved these peptides for medical use. And for athletes, there's another consideration. Many peptide-related substances fall under anti-doping restrictions. My bottom line is fairly simple. The Wolverine Stack is scientifically interesting, but the hype is running well ahead of the human evidence, and it should not replace proper diagnosis and structured rehabilitation. For most tendon, ligament, or joint problems, the fundamentals still matter most: accurate assessment, physiotherapy, load management, and where appropriate, treatments backed by stronger clinical evidence. As research evolves, peptides may eventually find a clearer role, but for now, caution is essential, and any decision around experimental therapies should be made with qualified medical guidance. Thank you for watching, and I'll see you in the next video.